very good evening to our home viewers and Facebook followers. Welcome to Med Talk. Tonight with me is a very special guest, Dr. Elaaj Khan. Welcome, Doctor.
Thank you.
He's a surgeon working in Abir Medical Group and a specialist in breast oncology. Now, the month of October is known as the Pink Ribbon or the Breast Cancer Awareness. Tonight we would like to create a platform for you as viewers to ask your questions. Breast cancer is curable, but most importantly, it is preventable. And therefore, please send your questions. I will be able to see it here on my phone. And as you are sending it, I will then ask Dr. Elaaj to answer these questions. Dr. Elaaj?
Well, thank you very much, Angeline. My name is Elaaj Khan, and I'm working as a consultant in the Abir Medical Group and providing the breast cancer care services here. And welcome to all viewers, my Facebook followers who follow me and who are taking my advice regarding the breast cancer. We all welcome you in this show, Med Talk. And we are here to provide you your questions and queries regarding the breast cancer.
So, Doctor, we don't have yet a question, so I'm going to ask you now. Tell me, what is breast cancer?
Basically, breast cancer is the cancer cell in the breast tissue and have a potential to metastasize to different parts of the body, and it is usually present as a breast lump.
So, doctor, are all lumps dangerous?
Not really. All breast lumps are not cancerous, but there are some specific signs and symptoms which is alarming that you should be evaluated as soon as possible.
What are those alarming signs?
Well, there are different alarming signs of the breast cancer. First of all, whenever you feel the hard lump in the breast, it's one of the alarming signs. Irregular surface. If you feel the skin nodularity in the skin puckering, teething over the skin, nipple retraction, there is eczema which is not healed by the normal medication, or special appearance of the breast like peel the orange, like peel of the orange feeling of the lump, or peel of the orange breast is the alarming sign. And whenever you feel these kind of the sign in your breast, you should directly go to the doctor for the further evaluation.
But doctor, before I will go to a doctor, surely there's something I can do at home to detect some of this lumps or some of the orange peeling feeling that you're talking about?
Well, I usually advise that it is according to the new guideline, the standard guideline, they prescribe the specific examination which is usually done by the woman, which is called self-examination.
Self-examination?
Breast self-examination. And breast self-examination is one of the tools that you can easily detect the lump in your breast by examination yourself.
So, are there steps that I need to follow? Can I just start massaging my breast, or are there steps for self-examination?
No, there are the 5 steps in the self-examination, and 3 maneuver you have to look. First of all, observation. Number 2, palpation, and number 3, squeezing of the breast. The step 1 is you should stand in front of the mirror and put hand on your flanks and observe the changes in the breast. What are the changes? First of all, you see the shape of the breast. You have to see the size of the breast. If there is any lump, any change in the shape between two breasts, and nipple retraction, any skin nodularity, any pale orange appearance. If these appearances are observed, you should directly go to the doctor. Step 2, that you have to observe your breast and axilla by raising your hand, and this is observation should be in front of the mirror, and you will look all these alarming signs which I described you before. And the third step is you have to palpate. You have to palpate your breast with your fingers while standing position and while laying down in position. Left breast should be examined with the help of the right hand, and right breast should be examined with the help of the left hand. If you feel any lump, any hard mass, any nodularity, any teething in the breast, any nipple retraction, or even the nipple discharge. For nipple discharge, you can observe or you can do the maneuver called squeezing of the breast. While squeezing of the breast, if you find the nipple discharge, this is also an alarming situation and you should directly go to the doctor. The step 5, that while you're taking the shower, especially the wet breast is the best method. When you examine the breast in the wet form, you can easily identify the lump. The question is that when you will do the self-examination.
Yes, I wanted to ask this.
Yeah.
When should I do this?
Yeah, usually
test?
after the menstrual cycle, the finish of the menstrual cycle, this is a very good time. Then you can do the self-examination, and by doing the self-examination, you can easily detect and identify the lump from the breast. And if you have observed that these are the alarming signs which I described here, you should directly go to the doctor for the further evaluation.
Doctor, I see that there's no questions yet coming from the viewers, so I'm going to ask a couple of more questions if you don't mind.
No problem.
So, what are the causes of breast cancer?
Well, there is no specific causes of the breast cancer, but there are different risk factors. And the risk factor includes age of the patient. Mostly the breast cancer happen after the age of the 40, but during my experience, clinical experience, I observed that the breast cancer can occur at the earlier age as well. And I have operated many patients at the age of 26 and at the age of the 30 that they are suffered from the breast cancer. Secondly, the gender. Most likely the breast cancer usually happen in the female, and this is an unfortunate thing that this is common in the female as compared to the male. And according to the statistics, only less than 2% men suffered from the breast cancer. Those women who has menstrual cycle at the age of 12, they have also chances of increased occurrence of the breast cancer. And those women whose menstrual cycle finishes after the age of 55, like late menopause, this is also one of the alarming situation that they might suffer from the breast cancer. Moreover, if there is obesity after the menopause is one of the also risk factors, and those who are taking the birth controlling pills, those women who has late marriages, those women who give births after 35 having increased risk of the breast cancer, and lastly those women who doesn't feed their babies, they also have a chance of the breast cancer. That's why I always advise to my mother, always encourage the breastfeeding, because this is one of the tool for the prevention of the breast cancer. And lastly, lack of the exercises, consumption of the fatty meals is also one of the risk factors. Smoking, alcohol consumption, which is controllable risk factor for the breast cancer. So we should avoid. One more thing, that breast cancer also possible if you have a strong family history. Because if your first degree relative like mother, sister or aunties have a breast cancer in your family, so there is a high chances of breast cancer in you. So there is a genetic transmission as well. For the genetic transmission is also one of the risk factors for the breast cancers.
This is a question that I wanted to ask, Doctor. My auntie has breast cancer. Does it mean I will also get breast cancer?
Definitely, auntie means your
from my mother's
side. Yes, yes, you have also chances of the breast cancer. And what I advise you, those who has a strong family history of breast cancer, they should do the self-examination every month, and if they found any lump, so they should go for the screening program.
So I should go to any doctor? Can I go to any GP if I have found a lump?
If you found a lump and they have a specific sign which I described you, that's hard lump, skin puckering, nipple retractions, so I always advise you, choose a doctor who is specialized in breast cancer. Don't go to the doctor who is not specialized or inexperienced regarding the management of breast cancer. So it is my advice to you, whenever you feel the hard mass or lump or any alarming sign, choose a doctor who is specialized or specially trained for dealing with breast cancer.
Okay. So I heard that people say that we need to go for yearly mammograms, but I'm afraid of going for a mammogram. Can you tell me what is a mammogram and if that is really a very good diagnostic way of detecting cancer?
Well, regarding the screening program, there are different guidelines, but the most of the guidelines conclude that the woman after 40 years with the average risk factor, they should go for the mammogram screening. Mammogram is a specialized X-ray which has a very low dose of radiation, and it is usually helpful for detection of the breast lump, especially after the age of the 40. Not only the breast lump, the mammogram also helpful for to see the microcalcification in the breast. Microcalcification is a small calcified lesion in the breast. It could be the malignant. This is mammogram is also useful for the detection of the multifocal and multicentric breast diseases. So it is a very good test and good for the screening as well as diagnostic things.
Doctor, I've seen that Ms. Fatma Nazreen is sending a question, so let's read it. Will the removal of the uterus be a cause of breast cancer?
Removal of the uterus, in what sense? Basically, if you have a history of the uterine endometrial cancer, so yes, endometrial cancer, colorectal cancer is also the risk of the breast cancer. But if you remove your uterus with for the fibroid, so it's less likely to increase the risk of the breast cancer.
So that actually brings me to a question I wanted to ask you later about, but I think now is a good time. Angelina Jolie have removed both of her breasts, but she did not have breast cancer.
Yeah.
Why do you think she did it, and was this preventative?
Basically, the famous Angelina Jolie has the lobular carcinoma cyto, which is a pre-cancer stage, and she has a strong history of the breast cancer. So those who has a strong history of breast cancer and they have a BRCA gene detection, there is a potential to develop breast cancer in the later life. So in this condition, we should provide the bilateral prophylactic mastectomy. So basically, she is a risk for the breast cancer, and she underwent for the bilateral mastectomy. Bilateral mastectomy means, for the viewers, I can define as the removal of the both breast to avoid the to prevention of the breast cancer in the future. And then she underwent for the breast reconstruction. So this is the preventive kind of measurement for the breast cancer.
I will ask you a little bit later during the program to give more details about reconstruction of breast. But let's go back to a question that Fatma. Hello Fatma, thank you for your second question. She's asking, is breast cancer completely curable?
Yes, breast cancer can be completely curable if you detect early stage. If you detect in the stage 1 or stage 2, so we can provide the curative treatment, and the 5-year survival rate is about 98% to 100% if you detect at the right time.
Thank you, Doctor. Mr. Siti is asking, breast cancer and genetics, is it connected? And I ask a question about my auntie that has breast cancer, so can I get it? But could you answer a little bit more in details if genetics and breast cancer?
Breast cancer can possible with the genetic connection as well, because there is a gene called BRCA gene, BRCA1 and BRCA2. If anyone has a strong family history, it means there is a genetic mutation in the BRCA genes, and there is a high chances for the possibility of the breast cancer to the person. Recently, I have one friend, she's a doctor, and her mother has diagnosed the breast cancer at the age of the 50, and unfortunately she diagnosed the breast cancer at the age of 30 because she has a high risk of the breast cancer. Yes, there is a strong genetic connection for the occurrence of the breast cancer.
So would you then recommend for ladies to know their family history? I need to know my mother has hypertension, or her mother died of breast cancer, and so on, right?
Yeah. Basically, what I advise to you, that whenever you find a lump, you should go to the doctor for the assessment. Yes, the breast lump assessment include the 3 essential part: clinical history and examination, radiological assessment, and clinical and histopathological diagnosis. The doctor you choose, if he is specialized in the breast care management, he should ask about your lump, and he should ask about your risk factors. And risk factors include the genetic transmission as well, a family history as well. And those who has a strong family history, I advise you to go for the genetic mutation screening as well. If you found there is a high potential for the breast cancer, then we can do the prophylactic measures for the prevention of breast cancer in future.
Doctor, now let's say a lady detected the lump. She went to the doctor and he's advising her to do a biopsy.
Yeah.
Is biopsy safe, and should I be admitted for a biopsy?
Yeah, unfortunately in our society, whenever doctor advise for the biopsy, the patient usually fear for the cancer. If you found a lump, don't panic. Relax yourself, go to the specialized doctor.
Okay.
If doctor advise you according to the X-ray or the ultrasound assessment or mammogram assessment, there is a suspicious of lesion, you should go to the biopsy. Biopsy is a simple procedure. It's a daycare procedure. Okay. Your doctor can do in your clinic as well, as the outpatient department as well. A small, first of all, how it is possible, or what is the simple procedure. Basically, just doctor give you the pain relieving injection the site, and with the help of ultrasound or the mammogram, they took the small pieces from your lump and they sent to the further assessment for the histopathology. Because if once for the diagnosis, the biopsy is a key factor for the further management of the cancer.
Okay. Now, how long will I wait for the results?
Basically, usually biopsy will take at least 1 week to 10 days for the final diagnosis, but sometime it will take more time when there is a suspicious of breast cancer. So they should go for the receptor status as well, because receptor status is important for the management of the breast cancer. So that's why you should, whenever your doctor advise you biopsy, don't panic, don't fear, and should go to the doctor for the biopsy and should follow the advice from the doctor. It is really helpful for you for the early diagnosis.
Okay. So doctor, can you just tell me again, after I've received now the results of the biopsy, what is now the next step? You're speaking about receptors. What is receptors?
Yes. Basically, after the biopsy defined you the biology of the tumor. There are two important types of the breast cancer, which is called invasive ductal carcinoma. Those cancer which arises from the duct of your breast.
Okay.
Another cancer which arises from the lobules. It is called lobular carcinoma. If you diagnose as a breast cancer, so the next step is for the assessment of the receptor. What is receptor? There are three types of the receptor: estrogen receptor, progesterone receptor, and HER2 receptor. These receptors are important for the diagnosis, prognosis, and management plan of care. So definitely, once you diagnose as a breast cancer, you should go for another step for the identification of the receptors, and which is usually possible by the special test which is called immunohistochemistry. I'm not going to in detail for the immunohistochemistry, but for the layman purpose, or for the layman, it is just conclude that it is essential part of your histopathological diagnosis and future care program for the management of breast cancer.
Okay. So now, doctor, tell me, if the doctor says I need surgery, give me more advice of what to expect if the doctor says they will do surgery to remove perhaps the tumor.
Basically, once you diagnose the breast cancer, doctor cannot advise you directly for the surgery, because there are next step to know the distant mets. For the layman, what is distance mets? This is terminology defined as that how cancer can spread to different parts, because the cancer has a potential to spread different part of the body like lungs, liver, bone, brain. So before proceeding the plan of care, you should rule out the potential of the cancer for the mets. If there is negative for the metastasis, that means there is no cancer in different part of the body, then we can plan the management plan. We can tell you the surgical plan. If your tumor is smaller, it's like stage 1 or stage 2 tumor, we can provide you the breast conserving surgery. If your tumor is bigger, so our plan will be changed according to the status.
So if I need surgery, what are the complications?
Before proceeding for the surgery, I will tell you about if tumor is more, because this is also important thing for the viewers, that sometime tumor is more than 4 centimeter, and the common question from the viewers is, we can go for the breast conserving surgery. Yes, we can go for the breast conserving surgery for the tumor more than 4 centimeter. How we can do in this condition? We discussed this case with the tumor board, and after discussion of the tumor board, we can give the new adjuvant chemotherapy. The question is that, what is new adjuvant chemotherapy? The chemotherapy which usually given before the surgery is called new adjuvant chemotherapy. The purpose of new adjuvant chemotherapy is downsize the tumor.
Okay. So this is chemotherapy that I will receive before the surgery.
Before the surgery. The advantage of this chemotherapy is you should downsize the tumor, stage number 1. The size of tumor can shrink, and you can provide the breast conserving surgery after
How
chemotherapy.
long will this treatment be, doctor?
Basically, usually for neoadjuvant chemotherapy, 6 to 8 cycle are advisable. And after completion of the cycle, we should go for the breast assessment. And if tumor size is decreased and the treatment response is well, so we can provide a surgical treatment 5 weeks after the chemotherapy.
Okay.
After finishing the chemotherapy, we should wait 5 weeks, and then we can plan for the surgical management.
So I think it's a good time now to discuss reconstruction of breasts.
Yes.
After the surgery, how long after surgery will I know that I can now have construction of my breast?
Basically, there are 2 school of thoughts for the breast reconstruction. One is called immediate reconstruction, and one is called delayed reconstruction.
Can you repeat that, doctor?
Immediate reconstruction and delayed reconstruction. Okay. Immediate reconstruction we can do after mastectomy. We can do the reconstruction like silicone implant. We can this is one of the good thing that you can do the immediately after the mastectomies. Second is delays after chemotherapy, and after completion of the treatment, we can do the reconstruction of the breast with the different muscles. So this is called the late reconstruction.
Okay. We have a question from Mr. Sadiq. I suppose he's here with us in Saudi. He's asking if there are any initial treatment that Abir could provide him.
Yeah, basically, fortunately, we have started the breast cancer services in Al-Abir, Makkah, and I operated 2 patients last month, and fortunately, our plan of treatment was very good. One patient underwent mastectomy, and another patient underwent the lumpectomy, and we did the standard care. In lumpectomy, I did the lumpectomy with the sentinel lymph node biopsy, which is first time happened in Al-Abir, and it was successful because sentinel lymph node was negative, and I sent the oncotype DX for the further plan of management, and oncotype DX shows less than 15% recurrence chances, so patient is not going for the chemotherapy. So we have started our services, and we have planned to expand our services in future as well.
That sounds like a great service that will be provided for our community here in Saudi Arabia, doctor.
Yeah.
I would like to go back to chemotherapy. What are the complications of chemotherapy?
Well, chemotherapy has definitely, the chemotherapy drugs has side effects, and not only chemotherapy, well, all the drugs have side effects. So there are few side effects like fatigue, number 2, patient having the alopecia, the loss of the hair, loss of the nails or brittle the nails, GI upset, sometime renal dysfunction, sometime cardiac dysfunction. These are the side effects while using the chemotherapy. One more thing, that sometime the WBC count can also down by the effect of the chemotherapy, and patients suffer from the fever, which is called febrile neutropenia. So this is common side effects of the chemotherapy while using and treating breast cancer.
Just a reminder to our viewers out there, we are still hoping that you will send us more questions. We had a very good, knowledgeable discussion so far, but I'm sure those of you that are having questions, please feel free, and all your questions are welcome. Doctor, explain to us, what is the difference between curative and preventative?
No, palliative. I think
Palliative.
yeah.
Curative and palliative.
Yes. Basically, the curative treatment defined as the disease-free treatment. We provide the surgical treatment and we control the systemic treatment. We provide a systemic treatment and control the disease, and patient having the disease-free period, which is called curative treatment. And the palliative treatment, we just provide the symptomatic treatment, like the patient having stage 4 cancer and they have metastasis in the bone. So we cannot cure the lesion, but we can provide the pain, radiation therapy to the bone to relieve her symptoms. So these are called palliative treatment, and palliative treatment is just for the simple or layman people, is simple for the symptomatic treatment for the breast cancer.
Doctor, I'm going to ask you also to give us a summary, something that we can remember as girls, as ladies. What can I do to prevent breast cancer? And you said something about smoking, to stop smoking.
Yeah.
You mentioned daily exercise. And why is exercise so important?
Yeah, exercise is important because basically the purpose of exercise is to prevent obesity, because postmenopausal obesity increases the risk of the cancer.
Okay.
The question is why?
Why? Yeah.
Why? This is why postmenopausal women, because during premenopausal period, the estrogen is coming from the ovaries, and after the menopausal period, the estrogen is coming from the adipose tissues and fats. These estrogen directly interact with the breast tissue and increase the growth of the cell. Second thing is that different inflammatory mediators like cytokine is also mediates the promotion of the growth of the breast tissue. So these are the factors. That's why we advise that please do exercise, don't be obese after menopause, to prevent the breast cancer. And this you can easily control, and this is included in the controllable risk factor.
Yes. So it is. Are there certain food, obviously, that I can
of course,
prevent?
see the processed food. Usually, I advise the processed
food,
tin
processed
food.
meats,
Yes,
takeaways.
yes, takeaways, burgers. These are the all you should avoid, and take natural fruits, natural food, which is healthy food, which is usually essential for the body. So you can prevent this. I think you can control yourself, and you can avoid.
So this is controllable.
Yes.
So we spoke about diet, exercise, stopping of
smoking and decrease alcohol consumption.
Decrease alcohol consumption, very important. And then also the early detection by the self-examination. And nurses or ladies, they can actually go to the nurses in the clinics. Yeah. Nurses are taught how to teach the patients how to do it.
Yeah, basically, you know that this is all combined effects. Not one physician can do. We have to teach our nurses staff as well how to do the self-examination. If we are successfully teach our patient, our first of all medical staff, to aware them that this is important thing, and we have to control. These kind of the. We can control the occurrence of the breast cancer by early detection. So we have to teach them effectively, and then our nurses can teach the patient effectively. These are all vicious cycle. If you provide the good quality teaching to our medical staff, so they can easily teach to our patient, and patient do the self-examination monthly, so they can detect the lump at the earliest stage, and we can provide the curative treatment.
Doctor, I would like to also ask about breastfeeding, but now we have a question from Mr. Unikrishnan.
Yes.
What is the actual phenomenon happening inside the body that later shows up as a lump, which later indicates as breast cancer?
Basically, the lump forms, he is asking the pathophysiology.
Yes.
Basically, the abnormal growth of the cell in the lump, in the breast, causes the lump. If your breast started to develop the abnormal cell, and abnormal cell get together and develop the lump, this is the alarming sign. And I already told you that not always all lump are breast cancer, because younger stage, if young girl come to your clinic with complaint of lump and lump is mobile, firm in consistency, so it is not cancer, it is most likely the fibroadenoma. So the specific sign which I already described to you, that due to the abnormal pathological process in your breast, once your lump develop, you should examine, and if you feel that is a hard lump, unusual finding, as I told you before, you should directly go to the doctor.
Yeah, no, that was not a question. Okay, so let's go back to breastfeeding. You say that all mothers that are pregnant and that are in childbearing age should consider breastfeeding their babies as long as possible.
Yeah.
And what is the physiological reasons behind this?
Basically, breastfeeding is decrease the exposure of the estrogen, and the breast development is due to the estrogen.
Okay.
So once you are giving feed to your baby, so it's less exposure of the estrogen in your breast. So this is one of the preventive measure for the occurrence of the breast cancer. And unfortunately, in our society, there is a trend that the mother is not willing to do the breastfeeding. This is my humble advice to all mothers. Please do the breastfeeding. This is the natural prevention from God.
Yes.
If you feed your baby, it is automatically prevention of the breast cancer. So please promote breastfeeding. Prevention is one of the prevention from the breast cancer. Breast cancer is a lethal disease, and those who suffer from the breast cancer, you can ask them, their life is totally spoiled. So please you can avoid the spoilage of the life by doing the breastfeeding, and this is also the natural gift from the God. So promote the breastfeeding, go for the promotion for the breastfeeding. And I always discuss with my patient as well, this is one of the good tools you can prevent the breast cancer.
We have another question by Mr. Rabail Khan. He's asking, what are causes of breast cancer in young females?
Well, in young female, I usually observe that there is a genetic transmission. I operated 2-3 patients. She has a very strong family history of the breast cancer, and one is Saudi woman. She came to my clinic a couple of years ago, and she has very strong family history of the breast cancer, and she is diagnosed at the age of 30. Another example I give you, one of my colleague, she is a doctor. She has a strong family history. Her mother is diagnosed at the age of the 50 breast cancer, and she has developed the breast cancer at the age of 31.
21,
so
that's
31,
very young.
31.
31.
Yeah.
Still very young.
So it's, yes, there is a connection of the genetics with your family. If you have a strong family history, yes, you can develop breast cancer at earliest age.
Doctor, can you share with us a success story of a patient that you recently had that detected cancer, and just go through us with the stages of treatment with
Basically, I want to share one of my patient, and I recently joined a Labir medical group, and unfortunately the patient had a breast lump, and she was going to different doctors, and it was my second day in the Labir medical group when she came to my clinic. And after initial examination, I observed that she has some unusual finding. If she was at the age of 38, 39, so I advised ultrasound. And after ultrasound, they give us report as a Barrett 4 classification. Barrett 4 is called suspicious of lump. So whenever your radiologist tell you the Barrett 4, that you should go for the biopsy. The problem is that that lady in Makkah, no one is there for the biopsy. So I decided to do the biopsy myself. So I did the ultrasound guided two-cut biopsy for her, and unfortunately the result came as a breast cancer. Now this is the one of the challenging for me that how I deal in this limited resources. Anyhow, I decided that I want to treat this lady, because if I cannot treat this lady at this stage, might be possible she can go to different doctors and they are unable to treat, and the cancer might metastasize. So I decided and talked to the management to provide me the facilities, and I'm really thankful to them that they provided me whatever I want to them. They provided me, and I planned this lady lumpectomy with sentinel lymph node biopsy. She took the second opinion from another doctor. Most of the doctors are willing to do the mastectomy with the axillary clearance, but you know the complication of axillary clearance is very high. So to avoid her the complication, I decided her to do the sentinel lymph node biopsy. Although it is very challenging for me that how to arrange the frozen section, how to do the oil management, but unfortunately with the help of the management, I operated that patient with successfully, and I removed her lump only, and with sentinel lymph node, and unfortunately her axilla or underarm there is no mets, there is no cancer in the axilla. So, and it was the negative margin free resection. Margin free resection is defined as there is no tumor cell around the lump, and there is no tumor cell in the breast. So, it is called a negative margin resection. Then what I thought, because after the final histopathology report, I felt that the Ki-67 was less than 10%. So, I decided that how I prevent this lady from the chemotherapy. So, I discussed this case in the tumor board, and after discussion we conclude that we should go for the Oncotype DX. Oncotype DX is the specialized test, and which usually advise for the patient who has the estrogen positive receptor breast cancer. This test help you to provide the risk assessment, either there is a chances of recurrence or not. And I discussed with the different oncologists, and we have successfully sent her report for the Oncotype DX, and by the grace of God, after the result she has a 15% risk. 15% risk means there is less chances of recurrence in next 10 years. So now she doesn't need any chemotherapy. She need only the hormonal therapy, because she has the estrogen receptor positive and PR receptor positive, and she need a short dose of the radiation therapy. So she is going for the radiation therapy and hormonal therapy.
Doctor, give us a little bit more detail about hormonal therapy.
Basically, breast cancer, you know, the basic pathophysiology behind the development of breast cancer is estrogen. Estrogen is a hormone which is usually secreted by the ovaries. So those patient who has positive ER receptor, like estrogen receptor, so we have to give the hormonal therapy. And for the pre-menopausal women, we provide we are usually advise a tamoxifen, which is usually block the estrogen receptor in the breast and avoid the development of or recurrence of the breast cancer in the future. Or for those patients who develop the menopause, we can provide another treatment called aromatase inhibitor, because as I told you earlier that the breast cancer usually develop a postmenopausal, the estrogen usually develop in postmenopausal from the different fat tissues and adipose tissues through the enzyme called aromatase. So we usually block this enzyme. So the hormonal therapy for the postmenopausal is different. We give the aromatase inhibitor, which block the conversion of the formation of the estrogen. So usually give the 5 years those who has estrogen positive receptor.
Is it a treatment that she will have to drink every day, tablets she will have to drink?
For the tamoxifen, yes, 20 milligram daily she has to take, and you have to take this tablet for the 5 years. And during taking this tablet, there are some precautions. Because by taking this tamoxifen, there are high chances of endometrial hyperplasia and cancer. So you should go for periodically for the gynecological assessment regarding if you feel any blood in through vagina, you should go for the final assessment with gynecologist, because one of the side effect for the tamoxifen is development of the endometrial hyperplasia or cancer. So you should go for the periodic assessment with the gynecologist while you're taking with the hormonal therapy.
So it's very important for young ladies and females of all ages to go frequently to her gynecologist.
Yes, if
and for checkups, right?
yeah, basically if you prescribe the tamoxifen, so I usually advise every 6 months they should go for the one time gynecological assessment.
Every 6 months.
Yeah.
Okay. Doctor, we have another question by Samia. She's asking, if a young patient present to you with advanced diseases like stage 3, stage 4, and want her breast to be conserved, what would you recommend?
Basically, advanced disease, I can tell you the advanced disease. One is called the locally advanced breast cancer. Locally advanced breast cancer is the cancer occupied breast, your skin locally, but there is no distant mets. The second is called advanced breast cancer. Advanced breast cancer is that the cancer is spread all over the body. The cancer is spread all over the body, we cannot provide the curative management, and the 5-year survival rate is 21%. But if you diagnose as a stage 3 or 3B, which is called the locally advanced breast cancer, in these circumstances, we usually provide the neoadjuvant chemotherapy to downsize the tumor, to decrease the size of the tumor. After giving the chemotherapy, we will do the reassessment of the breast. If the tumor responded well with the chemotherapy, so after reassessment, if the stage 3 converted to stage 2 or 1 after taking chemotherapy, so definitely we can provide the breast conserving surgery. One more thing I also want to add in this scenario, you should always look for the axilla assessment as well, because initially the breast cancer is spread to the axilla, and if your axilla is positive, so your treatment plan totally change, and you should go for the axillary clearance. So in these circumstances, what I advise you, any healthcare practitioner or who is dealing with the breast cancer, you should always go for the axillary biopsy as well. Along with the breast biopsy, you should go for the axillary biopsy. Once your axilla is positive, then definitely she needs axillary clearance or removal of, what is axillary clearance? I need to explain that removal of the lymph node from the axilla is called
removal of the lymph node from the axilla.
So axillary clearance is important or mandatory in these circumstances. But once your axilla is negative after the biopsy of the axilla, so yes, we can provide the sentinel lymph node biopsy while doing the surgery, and we can save or prevent the axillary clearance, because axillary clearance has severe complications.
Like what, doctor?
Well, this is a very important question, and every patient should know what are the complications for the axillary clearance. The first complication is the seroma formation. While doing the dissection, your lymphatic ducts destroyed, and it causes the serious discharge. It's called seroma. You can develop the hematoma. The severe complication is lymphedema. Lymphedema is a severe complication, and this is a common complication which I observe. There is two nerves, there's long thoracic nerve and nerve to latimus dorsi. There is a chances of injury to the nerve. If your lymph node is matted in the axilla, so there is a high chances of injuries to these nerves. So if you injured or your surgeon injured these nerves, you can develop the winging of the scapula, or you cannot comb your hairs with the injury of the nerve to latimus dorsi.
So you won't be able to move your arm normally.
Yeah. And lastly, there is some sensory loss as well, which is not harmful, but the lymphedema and nerve injury is an important complication of axillary clearance. So I always advise to all my colleagues and friends, please do the axillary assessment before your plan of treatment, because once your axilla is negative, so you can prevent the axillary clearance, and you should not rush to the patient for the axillary dissection, because our plan and of management should be according to the standard.
Yes.
So we should do plan according to our biopsy or results. If your axilla is negative, I would not advise to go for the axillary dissection. But what I observe that those who are not practicing, especially breast care management, so usually even my colleague as well, I saw that they directly go for the axillary dissection.
And that's unnecessary.
This is unnecessary.
Okay.
And I would not advise that you should go for the axillary dissection without any justification.
Doctor, we have a question by Mr. Shahid. He's asking, what is the role of brachytherapy?
Well, brachytherapy is basically the localized breast cancer. You should give the radiation to the localized area. In our practice, we are not usually giving the brachytherapy for the breast cancer, but one tool here in King Faisal Hospital, they started the intraoperative radiotherapy.
Intraoperative radiotherapy.
Radiotherapy, yes. Here is the role of the intraoperative radiotherapy while you are operating the breast cancer, especially ductal carcinoma in situ. Is very good results.
So the patient will receive radiotherapy while he's operating.
Yes, it is called intraoperative radiotherapy.
And then radiotherapy treatments or sessions will follow afterwards?
Yeah, afterwards. Basically, the purpose of this, if you are having the big margin of the DCIS, so it's usually given, but not all oncology center following because it's a new modules. Okay. So they are not following the intraoperative. Few high center they started for intraoperative radiotherapy.
Doctor, let's summarize our discussion. If there are still questions, no problem, please send your questions, and even if we close the show, I'm sure Dr. Khan will be able to answer your questions later. Could you give me in a nutshell, again, the most important signs that young girls, laymen, the community out there can look out for to detect breast cancer? And then obviously the treatment that can follow, and give us your advice so that we can make sure that the community out there are aware about this disease.
Yeah, thank you very much. Basically, in the end, I must say that always do the self-examination after finish your menstrual cycle. Whenever you find any suspicious lump which has the hardened consistency, there is a puckering of the skin dimpling, fluidy orange appearance, nipple retraction, nipple discharge, or any eczema or breast sores, which is not healed by usual management, these are the alarming signs. Should go to the doctor. Don't hesitate, don't shy, always go to the doctor, because this is for your own prevention, and prevention is better than cure.
Doctor, just one more question from my side. Tonight we focus mostly on females, but can men also get breast cancer?
Yes, the men can also get the breast cancer, and the incident rate of the breast cancer in the male is less than women. I already told you earlier that less than 2% men can suffer the breast cancer, but unfortunately the man breast cancer is really aggressive breast cancer, and we need to address it as soon as possible, otherwise it will metastasize immediately, and at the end we cannot give the curative treatment. So yes, man has also chances for the breast cancer, but although the percentage of the incident of the breast cancer is low, but still present.
And the signs will be the same for men, doctor?
Almost signs are the same. The man has a rudimentary breast, so the breast lump is more obvious in the man as compared to woman.
Okay.
So usually the man can easily diagnose, or they can feel the changes in their breast, and they come directly, but unfortunately they neglected their lump. This I told you, whenever you find any lump with the same sign which I described you earlier, always go to the doctor. Either you are male or female, you should go to the doctor for the further evaluation. If your doctor evaluate you, then definitely you can go to the conclusion that either you have a breast cancer or not. And the topic is early detection, and we are promoting the early detection.
Yes.
Because early detection for the curative treatment. Late detection, we cannot provide you the curative management, and your life will be hell. This is curable disease. I advise you, please concentrate. Breast cancer is curable once you diagnose earliest stage.
Thank you so much, Doctor. Thank you to our viewers.